for the Lions in Sight missions. To introduce myself, I'm for the Lions in Sight missions. To introduce myself, I'm Dr. Karina Vandepol, or as I'm known in Mexico, Doctora. And I'm going to be talking to you a little bit in this video about optics and refractive error. It's helpful if you understand what it is a patient has, if they have myopia, if they're nearsighted, or if they have hyperopia and they're farsighted. And then, especially when you go to give them their glasses, is a plus pair of glasses the right thing for them, or minus pair of glasses, and you can understand that close with emetropia. What we really want to talk about here, though, are the various categories of refractive error, such as myopia, commonly known as nearsightedness, hyperopia, known as farsightedness, and astigmatism. So the first refractive error that we're going to talk about is myopia. The picture that you see here is actually one of Lions Club members who has myopia, and the reason you can tell that he has myopia is that if you take a look at his eyes, they actually look small behind the eye lenses. So if you take a look at what somebody with myopia might see, they're going to see things better up close than they see far away. So hence the name of the condition is nearsightedness. So poor distance vision and eye strain are typical symptoms of myopia. How do you correct myopia? Again, I alluded to this. It's a minus lens, and these lenses are typically, we call negative power. Just the side shape of the lens, they tend to be thin in the center and kind of thick at the edge. An example prescription for myopia, typically you're going to see minus in the prescription. And OD is right eye, and OS is left eye. And so in this prescription, we have an OD power of minus 3.25 for the right eye and minus 2.75 diopter sphere for the left eye. For hyperopia, we have the opposite problem. You look at their glasses, you'll actually notice that their eyes look bigger behind the lens. Patients with hyperopia, they tend to see objects in the distance clearly, although they have to force their eyes a little bit to see those objects in the distance. And then objects up close tend to be out of focus. So how do you correct hyperopia? So with the myopia, we use negative lenses. With hyperopia, we use positive or plus lenses. And the lenses tend to be thick in the center and thin at the edge. And objects that are seen through the lenses are magnified. A prescription for somebody who has hyperopia, now you're going to see on the prescription, you're going to see plus signs. So for the right eye, we have an example prescription here of plus 3.25 sphere. Again, it's a single power. And for the left eye, or OS, we have plus 2.75 diopter sphere. Brings us now to the third refractive error, which is astigmatism. Typically, a patient who has astigmatism will complain of blurry vision both at distance and near. So my vision is blurry for far and near. And it tends to be a little bit of a distorted vision. Things are just sort of stretched, and they'll often have headaches because they tend to squint their eyes too. Another image here of astigmatism, what you can see on the lines of the tower, there's a bit of a stretching both up and down. So how do you correct astigmatism? I can't just give them a myopia pair of glasses or a hyperopia pair of glasses. I actually have to give them glasses that are very specific to the patient. Showing an example for astigmatism here, this example shows a -1 sphere. That means the patient has myopia, it's minus. There's a -1 cylinder, that's how much astigmatism they have, and then there's an axis of 180. So an example prescription, we have, in this example, I've got for the right eye a plus 3.25 sphere. Now this is a hyperopia, so it's plus, first number tells you hyperopia. Minus 0.75, the amount of astigmatism, and axis 180 horizontal. For the left eye, plus 2.75, so still hyperopia, a little bit less than the right eye. Minus 150 astigmatism, so slightly higher amount of astigmatism, and axis 170. This example of myopic astigmatism, now we see minus signs for the sphere. Same amount of astigmatism, but now the axis is 90 in the case of the right eye, and 85 in the case of the left eye. So the orientation is different. The final condition is actually not a refractive error, it's a consequence of aging. It's called presbyopia, presby meaning old and opia meaning eye. And the little bear sitting here is suffering from presbyopia, so we fit him with a pair of bifocals, and he's much happier, as you can see. So in the optics of presbyopia, essentially what happens is once you get beyond the age of 40, the lens inside your eye no longer has the ability to change shape to basically autofocus or bring things into focus as you look from far to near. So as it gets denser, as it gets less elastic, now you're no longer able to change your focus from seeing far to looking up close, and patients will complain that their arms are not long enough. So what is presbyopia? It generally starts around age 30 to 40, but patients don't really get the problems associated with presbyopia. They don't really get problems till they're probably around age 40 or so. It's a natural part of aging. So as you age, as shown in this chart, essentially a 40-year-old would need around +1 diopter of more power to see close. When you get around age 50, it's +2. When it's around age 60, it's +250. So here's an example prescription for bifocals. So looking at this, I could say the patient is myopic, they have astigmatism, but the thing that's very different and new is the very bottom power that you see that says add, ADD, that's the addition of +2.50. So looking at this, with a +250 add, possibly they're around age 60. This example is one that's a simple hyperopia, +350 and a +250 in terms of powers, and an add power +150. So this patient, hyperopic, probably around age 45 or so. And the final prescription is right eye +2 and left eye +2. And you might say, that looks like a hyperopia prescription. Well, kind of. It's the same sort of idea, your plus power, but this is for somebody who just needs the glasses for near. So they have emetropia, they see well far away, they've lived beyond the age of 40, now they need more add power to see up close, but they don't need anything to see far away, so they just need what we call readers. How common are these conditions? Well, if you take the world as a whole, having hyperopia, myopia, or presbyopia or astigmatism is actually a small percentage. But if you think about a clinic where patients come to get care, you're going to see a lot of presbyopes. So in the chart that I'm showing, I've got about 65% of the patients that come in are going to be presbyopes. So they need something to see near, but they also may need something to see far away. So those patients would need bifocals. About 10% of patients are going to have astigmatism. About 10% are going to be myopic, and about 15% are going to have just plain hyperopia without presbyopia. And this is sort of typical numbers for a Mexico clinic. If you go someplace else, you go to India, you're going to see more myopia. You go to Africa, potentially you'll see more myopia as well. So it varies by the part of the world that you're going. So with that, let's do a little test of your knowledge. The choices here, you're looking at a patient who has astigmatism, and your question is, what will a person with astigmatism complain of? Will they complain of blurry vision at distance, blurry vision at near, distorted vision, eye strain, eye pressure, or all of the above? I'll give you a moment to think about that. And it is all of the above. This is an example of a prescription. I've got a +175 for the right eye and a +175 sphere for the left eye. Is it a presbyopia correction, a myopia correction, an astigmatism correction, or a hyperopia correction? And again, just think about that. Plus power lenses. Actually, it could be a correction for presbyopia as readers, and it also is a correction for hyperopia. So plus glasses are for both of these conditions. Here's George Burns. A few of you may remember George Burns, and he's wearing a pair of glasses. Take a good look at his eyes and tell me, what kind of glasses do you think George Burns is wearing? The eyes look a little bigger, a little enlarged. Are they minified or magnified? Magnified. So these are plus lenses, and George Burns had hyperopia, and he was farsighted. Lenses to correct myopia are described as Are they described as cylinder lenses, plus lenses, minus lenses, or reading lenses? And again, think about it. Myopia starts with the letter M. Possibly it's minus lenses. So you as the dispensers, your role, give them the right pair of glasses, get that big smile, and feel really good about yourself.